Welcome back to this segment of Ethnic Health America. In this segment, we're going to talk about a special organization to deal with sickle cell anemia. That organization, the Sickle Cell Anemia Foundation of the East Bay. We're pleased to have its CEO and founder, Chaznee Brown. Welcome to our program.
Thank you.
Tell us about your journey through sickle cell anemia. You actually have sickle cell anemia.
Right.
And tell people how that differs somewhat from the trait that many other people have.
It differs significantly from the trait. The trait is when both of your parents have the sickle cell A trait or the S trait. And when the both of them come together, sometimes it's a 1 in 4 chance of creating a child with sickle cell anemia. Therefore, sickle cell anemia, what happens is that it can cause a severe amount of pain, meaning that the cells are changing shape, blocking oxygen from the blood, the veins, and therefore causing so much pain that sometimes it's unbearable. Now, the difference with the trait is that people with the trait don't have those symptoms.
So you've had in all your life, you've had the same problems. So that meant lots of times in pain, lots of times in the hospital. But we don't want to dwell on that. We want to talk about your success. I mean, you have come through all this, and tell us a little bit about your background now.
My background now is I actually just finished my master's in counseling, so I'm going to be taking that and using it in my organization as far as taking it to a point of mental health and sickle cell disease. So in spite of what I've experienced with my disease is that I've been able to be successful. I've been able to go on and persevere in spite of the difficulties that I've experienced.
Do you think the African American community knows much about sickle cell? I remember when I first came into this community, there were all kinds of organizations dealing with sickle cell. What's been your experience as a young person with sickle cell anemia?
As far as my experience, when I was growing up, I didn't tell a lot of people about my disease, and it's still prevalent today. A lot of people don't speak about sickle cell anemia. The African American community, they may be aware of it, but they may not know the significance of it. Some people are aware that they have the trait, some people aren't. So now that I'm trying to get out there and talk to the community and get the African American community to also be involved in donating blood, it has been a little bit of a challenge. Sickle cell has been going on for over 100 years now, about 100 years now. So it's hard when you're trying to reach out to, your fellow community and they're not sure what you're speaking of.
Well, now tell us a little bit about the Sickle Cell Anemia Foundation of the East Bay. Tell us why you founded it. What's its mission?
I actually thought to do this foundation when I was actually laying in a hospital bed one day. I said, there's no help for the adult sickle cell community. Where do we go to after we turn 18? We have nowhere to turn to. Where are the support groups? There aren't any. So I knew that once I started to get healthy, once I finished school, that I would take it to another level. I would be able to start those support groups. I would be able to utilize my degree and be able to make those things happen. So we are designed to get out there to advocate for sickle cell disease, to spread the awareness, to educate the community, to make sure that pregnant mothers are getting newborn screening, to make sure that the fathers are getting screening so that they know that if they have the trait or not. A lot of people don't know that. So it makes it difficult when you're expecting a child and it's like, oh, what is sickle cell? People don't know.
Does it surprise you and disappoint you that only 11% of the people who are identified by the screening ever go for the counseling?
It doesn't surprise me. I think a lot of people are scared, mostly. So and I work in genetics too at Kaiser. So I understand the importance of needing the counseling, but a lot of people just don't take it seriously.
Do you think that the treatment for sickle cell anemia has improved over the last 10 or 15 years that you've been involved in getting medical treatment? It seems like adults with sickle cell are living longer, more high-quality lives, and yet there's nothing for them. There's something for all these other diseases, some of the more obscure hemoglobinopathies and sickle cell. What about the treatment? Is it better? And why do you think there's not more emphasis on getting people together and providing services for adults?
I think we're getting there. It's still delayed some. We still need more people out there who are researching and trying to find a cure for sickle cell anemia. However, we are given medications to help us live longer. We are trying to stay on top of those medications to making sure that we stay longer. We're having more frequent treatments. more office visits. So we are getting to a point to where it's getting better, but it's not there just yet.
Okay, now when you found this organization, how can people who want to get involved with sickle cell, how can they get involved with your organization?
Right now, we're trying to be at as many different events as we can. We have a health fair coming up in August that we're going to do. Any other time, my phone number is available, my email is available, so I'm making sure that I'm out there giving out my business cards and making sure people know that if you want to come and help out, we're more than happy to help you.
Chaznee, I think that your example is sufficient to encourage people to get more involved in the whole sickle cell event. You've demonstrated that it's a challenge, but it can be overcome. It's not without great personal sacrifice, but still, I think there you are now trying to inform other people. So we're going to give people the information that they need to help you and to join your organization. And we want to thank you for taking the time to come. Although you're a relative, still, we don't always get relatives on our program, so we appreciate that.
Thank you.
And take care. All right, we'll be right back after this break.